One of these hair transplant methods leaves less scarring, the other might give you fuller results, but which one's right for you? The answer could change everything about how you approach restoring your hair. Hair loss isn't just about vanity. It affects confidence, relationships, and even mental health. And if you've looked into restoring your hair, you've probably heard of FUE and FUT. But what's the actual difference? Is one better than the other? What do surgeons not tell you up front? In this video, we're diving into both techniques, how they work, who they are for, the pros and cons, recovery and cost, so by the end, you'll know exactly which path might be right for you. Let's unravel the truth behind FUE versus FUT. Let's start by understanding what FUE and FUT actually mean. FUE stands for Follicular Unit Extraction. FUT stands for Follicular Unit Transplantation, sometimes called the strip method. Both aim to do the same thing, relocate healthy hair follicles from one part of your scalp to a thinning or bald area, but the way they do it is very different. In FUT, a surgeon removes a thin strip of scalp, usually from the back of your head. That strip is then dissected under a microscope into individual follicular units, which are then transplanted into the thinning areas. The donor area is stitched or stapled, which heals into a linear scar. FUE, on the other hand, doesn't involve removing a strip. Instead, it involves extracting individual follicular units directly from the donor area using a tiny punch, usually 0.7 to 1 mm in diameter. These are then inserted into the recipient area, just like in FUT. Now, why does this matter? Because each method has advantages and drawbacks, and they can dramatically affect your experience, results, and even lifestyle. Let's start with FUT. FUT is often considered the older method, but that doesn't mean it's outdated. In fact, it can be the preferred method for patients needing a large number of grafts. Since the follicles are harvested from the strip under a microscope, they often have less transection, that's the accidental damage to follicles during extraction. This can lead to a higher survival rate and denser coverage. But the biggest issue? The scar. Even if you have a skilled surgeon, FUT will leave a linear scar across the back of your head. For some, it's barely visible. For others, especially if you like to keep your hair short, it can be a deal breaker. However, there's a highly effective way to deal with that. Once the scar is fully healed, scalp micropigmentation, or SMP, can be used to camouflage it. It's a specialized technique that uses tiny pigment impressions to replicate the look of natural hair follicles on the scalp. When done properly, SMP can drastically reduce the visibility of FUT or FUE scarring, even if you wear your hair short. We would like to thank Ultimate Scalp SMP for some of the footage included in today's video. Ultimate Scalp SMP are based in Leicestershire in the UK. And we highly recommend them for any SMP treatments, as they have over 16 years scalp micropigmentation experience, plus, the owner personally has Scalp SMP himself for over 18 years. From genetic male and female baldness, to alopecia, hormonal hair loss and transplant scar and density work, they are highly experienced. Be sure to check out their website ultimatescalpsmp.co.uk. It's become a popular finishing touch for many transplant patients looking for the most natural result possible. Scalp micropigmentation can add great density and improve the sometimes underwhelming results that hair transplants offer, so factor potential SMP treatment into your plan for best overall results. Sometimes the patient does not have enough donor hair to transplant to bald areas, thus meaning neither FUE or FUT are options. In this situation, scalp micropigmentation is the best option for the illusion of a shaved head. With that said, let's get back to FUT. The recovery from FUT can also be a bit more intense. There are stitches or staples involved, and you might feel tightness or discomfort in the donor area for several days or even weeks. It also means a bit more downtime, and some physical restrictions during the healing process. Now let's switch gears and talk about FUE. FUE is often seen as the more modern, less invasive approach. Since it uses tiny punches to extract follicles individually, there's no linear scar. That means if you shave your head or wear it short, the scarring is far less noticeable, sometimes practically invisible. Recovery tends to be quicker too. There's minimal discomfort, and since there are no stitches or staples, you can get back to normal activities faster. That makes it a popular option for younger patients or those with an active lifestyle. But here's where things get interesting. FUE has a higher risk of transection. Because the follicles are being removed individually without full visualization under a microscope, there's a greater chance of damaging them during extraction. That means lower yield if not done by a skilled hand. Also, FUE often takes longer, sometimes spread over multiple days if you're getting a high number of grafts. It also typically costs more than FUT because of the labor-intensive nature of the process. So now we know the basics. But how do you actually choose? The real challenge arises when someone sits across from a surgeon and hears, "We can do either, it's up to you." That's overwhelming. Because unless you understand the deeper implications of each method, how they fit your lifestyle, hair type, age, and long-term goals, you're making a decision in the dark. And here's something a lot of clinics won't tell you: not everyone is a good candidate for both. Your donor hair density, the size of the thinning area, even the direction your hair grows, all of that plays a role. Let's break down a few real-world considerations. Imagine two patients, Alex and Daniel. Alex is in his early 30s, starting to thin at the front. He works a corporate job, keeps his hair fairly short, and plays sports on weekends. He wants something discreet with minimal downtime. Daniel, on the other hand, is in his late 40s. His hair loss is more advanced, and he's looking for maximum coverage. He doesn't mind taking time off to recover, and he wears his hair longer, so scarring isn't a major concern. For Alex, FUE might make more sense. No linear scar. Quick recovery. He can go back to the office looking almost normal within a week. And since his thinning area isn't massive, he doesn't need thousands of grafts. But Daniel, he might be better served by FUT. He needs more grafts in one go, and since he'll be wearing his hair longer, the linear scar won't be noticeable. The follicle yield will likely be higher, and he can achieve denser coverage with fewer sessions. Then there's hair type. Thicker, curlier hair covers more ground, meaning you might need fewer grafts. But if your hair is fine or straight, you'll need more coverage to achieve the same visual density. This could make FUT a better option in some cases. And what about future hair loss? That's huge. If you're still losing hair, you need a plan that includes how your transplant will look in 5, 10, even 20 years. FUE might allow for multiple future sessions without exhausting the donor area. FUT, on the other hand, might give you more bang for your buck up front, but it's more limited in repeat sessions because of the scarring. Another thing that often gets overlooked: surgeon experience. Some surgeons specialize in one method. Others offer both but may be more skilled at one over the other. The success of your transplant often depends more on the surgeon's technique than the method itself. So ask to see before and after photos. Look at patients with similar hair types. And don't be afraid to get multiple consultations. Finally, cost. In most cases, FUE is more expensive than FUT. That's because it takes longer and requires more precision per graft. But price should never be the only factor. A cheaper transplant that gives poor results, or one that damages your donor area, can end up costing more in the long run. So, it's not about which method is better, it's about which method is better for you. As an individual, FUE is ideal if you want minimal scarring, quicker recovery, and are okay with potentially needing multiple sessions. It's discreet, modern, and increasingly popular for younger or image-conscious patients. FUT is the go-to if you want the most grafts in one session, don't mind a scar, and are focused on long-term coverage over short-term aesthetics. It's more efficient in terms of follicle yield and might cost less per graft. But neither method guarantees success without the right planning, surgeon, and expectations. Don't choose based on hype. Don't choose based on marketing. Choose based on facts, experience, and what works for you. Hair transplants have come a long way, but with more choice comes more confusion. FUE and FUT both have their strengths and weaknesses. FUE gives you discretion and a fast recovery. FUT offers density and efficiency. What matters most is knowing your hair type, understanding your goals, and finding a surgeon who treats your head like a canvas, not just a job. Whether you're at the beginning of your hair loss journey or finally ready to make a change, remember, the right decision is the informed one. As always, make sure to like the video, subscribe to Dr. Follicle's hair and scalp care channel and hit that notification bell so you never miss an upload.